us. We had some technical difficulties, so hopefully everybody that was watching before gets back on. I'm going to just kind of continue with the question that we were asked before. So also, just welcome. This is Let's Talk Health live stream. I'm Dr. Amanda. We're going to be answering health questions, health Q&A. So we had a question about lion's mane and then the herbs that are marketed for brain power, I think it was. So should we take these herbs? So one thing I would say to be cautious with is the herbal and what we call like natural supplements, herbs and stuff. It's not always fully regulated. So you want to be careful with where you're purchasing these from. So it's okay if you hear, okay, lion's mane is good for brain power. It actually can be beneficial for the immune system, for cognitive health. That is true, but just be careful where you're getting this herb from. You want to just make sure, especially if you're buying things online from like Amazon or different retailers, where are these herbs sourced? Who are these companies? I always recommend doing ones that are third-party tested, and ones that are more professional grade. You're probably going to spend a little bit more money on them, but it's going to be beneficial more beneficial than just getting something that is maybe just from a company and that isn't.
Do you have a comment? Tested. Hey, I just joined. Can you please repeat what you have shared so far related to lion's mane and brain boosting supplements?
Yeah, so lion's mane, brain boosting or brain power supplements. So it can be helpful. It can be beneficial. So it is studied to be helpful like that. Same thing with Bacopa is another one, and ginkgo. But the point that I was mentioning is just being careful where you're getting this from. Like, where is the source of this? If you're just seeing ads on your YouTube, or if you're just seeing things on Amazon, you want to make sure it's a good quality supplement, because whenever we're looking at things like herbs and natural remedies, they can just be packaged and then not even be at like the optimal dose, so they can use fillers or other things. So that's one thing. Maybe they weren't tested properly, so like third-party testing is important. So I always recommend doing supplements that are more of the professional grade lines. I kind of mentioned it would be more expensive, but it's just going to be worth it.
So how do you find this? How do you find out if it's good or not? What are some things to look out for? If it's third-party tested, write it down.
So third-party tested. So you'll have to look at the company's website and see what they say. You can always email them and inquire, because if they are like good quality, they're going to let you know. If not, they're going to be just not giving you a straight answer. So that's one thing you want to look for. And then you want to look for the other ingredients.
You have 24 viewers.
Hi, thanks everybody for viewing. Welcome. This is Let's Talk Health. I'm Dr. Amanda, naturopathic doctor. We're talking a little bit about lion's mane, some brain power or brain boosting supplements. So if you've just joined us, make sure to subscribe and like the video and ask me any questions. So what do you want to look for a good quality supplement? So it should be third-party tested, so that the website should say that. You can contact the company. Look at their other ingredient list. So what else are they using, or what are they putting in there? And then the other thing to keep in mind is when it says it's a proprietary blend. Proprietary blend.
So proprietary blend is good or bad?
I usually don't recommend doing something that's a proprietary blend. It's not that it's bad, but you just don't know exactly what is going in it. So it can say it's a proprietary blend made with lion's mane, ashwagandha, and
mushrooms.
Mushrooms, sure. But you don't know exactly how much of each is in that blend. So especially if you want lion's mane to be the main one, that one you'd want at the top of the list. Because the higher up, or the closer to the higher up the ingredient list, there's more of that ingredient in the supplement. So I just stay cautious with proprietary blends, because you don't know exactly what's going into this. I see it a lot with probiotic supplements when there's just a proprietary blend, but it's like, okay, well, how much of that strain is in there? Is there like a minuscule amount of that strain, but they're putting it in there? It might not even be beneficial. So that's just what I would recommend. Those main three things when looking at supplements are important. The other thing is like the source. So something like fish oil, the source of the fish oil, where is it coming from? So is it things like anchovies and sardines? Those are usually a better sourced fish oil versus, I don't know, maybe it's coming from tuna, not really the greatest source of omega-3. So looking at the source of things. Okay, I need some water.
Yeah. Ed Jack asks, how do I cure my stomach problem? Help.
So what is your stomach problem? Let me know a little bit more about that. There can be so many different stomach problems. Just off the top of my head, if you're just having general stomach aches and pains, chamomile and fennel are two really good herbs that can help with stomach problems. So why don't you write down in the comments what your stomach problems are, and I'll just kind of do a little bit of a recap for anybody that's just joined us. Hi and welcome to the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. We've been answering some great questions, so feel free to drop any questions in the comments. We talked a little bit about what to look for in a supplement here, some different types of herbs that are great for supporting cognitive health. So if you're new here, be sure to subscribe. You'll get notified when I go live so you don't miss it. I do go live every day, so if you don't have a question today, come back tomorrow and be sure to like the video.
Just stomach aches.
Stomach aches, okay. Yeah, so stomach aches can be due to a variety of different things. One big thing for stomach aches is there's excess gas in the stomach. So I mentioned chamomile and fennel. Those are two really good herbs to help calm down the stomach and help with any excess gas and bloating. Another thing to look at is your diet. So maybe you're having something that is really greasy and heavy. Maybe you're not able to digest it that well. So looking into those things, what you're eating. So let's write down stomach aches here. So for stomach aches, I'd recommend, like I said, chamomile, fennel are really good. You might need to do something like a digestive enzyme with heavy meals. With heavy meals, and that can really be helpful. And then just looking at what's in your diet. So again, like, are you having a lot of really greasy foods? Are you having a lot of dairy? Are you having a lot of refined carbohydrates and sugar? Those can definitely contribute to stomach aches. So what I would say is assess your diet, drink some chamomile fennel tea, or even take it as a tincture, and then try to take a digestive enzyme with your really heavy meals and see if that helps.
Is papaya a good food for digestion-related issues?
Yeah, great question. So the question was, is papaya good for digestion?
Well, it's not a question, it's a comment. Someone said that it's good for digestion.
Oh, it
is.
is.
Do you agree?
Yeah, so papaya is. So papaya contains actual natural enzymes, something in there called papain, and that can be helpful for digestion. You can actually buy a supplement that has the papaya enzymes specifically. Good for digestion. It's generally well tolerated and safe, but yeah, you're right. Papaya is one of those foods that can be beneficial. Same with pineapple too.
Carson says, my head hurts really bad from a dirt bike crash.
Oh.
When was your dirt bike crash, Carson?
That sounds painful.
Yeah, so what do you recommend?
So first, I definitely recommend getting that checked out. So yeah, that you are getting proper care for that.
He says today.
Okay, so I would highly suggest to go, if you haven't done it already, go to the emergency room to get it assessed. You could potentially have a concussion.
MRI.
You might need to get an MRI to see what's going on, making sure that everything cognitively is working well. So I actually wouldn't recommend doing anything until you get properly assessed, and even things like supplements and herbs aren't good to take when you've just had an injury or an accident. You kind of need to let the body deal with the inflammation and let it come down, and then you can always do some anti-inflammatory things after.
Yeah, he said just 45 minutes ago, I can't remember anything.
Oh no. So you really want to go make sure you're getting checked. out. I would say avoid the screen, so maybe get off of YouTube, go to get somebody to take you to the hospital, because that can be definitely serious if you don't get it checked out.
Yeah, no Zins.
Okay. All right. So if anybody's just joining us, hi and welcome. I'm Dr. Amanda, naturopathic doctor. We are chatting about different types of health questions. So if you have any questions, drop it in the chat. Be sure to subscribe, join the community. Also like the video. It really does help with getting it noticed across.
Mayanka Sapra says, in my profession, I have to study a lot of tech stuff, and it's kind of boring. I struggle to focus on it. So looking for a pill that can make me more focused. Is it a correct way to solve this problem?
Yeah. So, I mean, I can imagine that with tech, there's so many little intricate things, and it's probably hard. And I know that I wouldn't be able to do that. So we talked a little bit about, supplements and stuff like that. Now, I mean, you asked, is it okay to do something like that? It's okay to take something like a supplement to help with cognitive health. Of course, always check with your healthcare provider and anybody watching. What I'm talking about, it's not medical advice, it's more so education, just to give you some information, and then go do your own due diligence and see if it's, suitable for you. But we talked about Bacopa, so that was something I talked about that can help out with memory, so that would be a good one to consider taking for helping. I talked a little bit about things like green tea has some mild caffeine in there, and some L-theanine can help out with cognitive health as well, can help out with memory or keeping you more focused and alert. The other thing I would say, if you're doing tech and you're like on the computer a lot, just give yourself breaks, because you're probably getting bored if you're just sitting there for a while. It's also not good if you're just like staying stagnant the whole day. So get up, maybe do a little walk around if you're in an office, or if you're at home, giving yourself some blood flow throughout your body. Like even every 30 minutes, just get up and walk around. If you're at home, maybe, and you work from home, maybe consider getting a standing desk with a treadmill underneath. That can also be really beneficial too. So when we're thinking about the body and like brain health, I like looking at things holistically. So not only are we directly going to do things to support the cognitive health, but how can we use other systems in the body to help with that as well? So using your cardiovascular system and getting moving can be beneficial.
Carson says, okay, I'm the only person I drive. I'll try. Thank you so much.
Okay, you're so welcome. I really hope you go get some treatment and you feel better. All right.
Are you referring to ginkgo biloba for increasing brain power and focus?
Yeah, that is one of them. This is Bacopa, this is a bit different, but yeah, ginkgo biloba is another one that can help with brain focus and cognition for sure.
Okay.
Yeah. All right.
Hello, doctor. I'm Baba from India. I have washroom problem. I'm going nearly 4 times a day. What is the problem?
Oh no, I'm so sorry to hear that, Baba. So if you're going 4 times a day, is it more mushy and watery, so you might be having diarrhea? There can be a variety of things that can cause this. So some questions I would ask you to consider is like, how long has this been going on? Is this chronic, which means it's been going on for months? Then you might be looking at something like IBS or even IBD, which is inflammatory bowel disease, where you have inflammation in the colon. So those are 2 more long-term things to look at. You need to go get properly assessed for those. If it's more short-term, where it's maybe just been happening on and off here and there, potentially it could be due to a microbiome imbalance. So that means like your good gut bacteria is off. So taking things like probiotics, digestive enzymes can help with that. Or you may even have a mild bacterial or yeast overgrowth. So doing a stool test can help you figure that out as well. So I would say more so just trying to figure out what is causing this, how long has it been happening. But in general, if you're having loose or bowel movements, you want to make sure you're staying hydrated, okay, making sure you're having a good amount of fiber as well. And then you can do things like herbs and stuff, so things like ginger and fennel tea can be really beneficial as well. Okay, so if you're just joining us, welcome to the Let's Talk Health live stream. I'm Dr. Amanda, naturopathic doctor. We talked about stomach aches, we talked about brain memory boosting supplements. So if you're new here, feel free to subscribe and like the video. I really do appreciate it. I like hanging out with you guys and answering your questions. So drop any questions in the comments. I'll hang out for a little bit longer and then I'll be back tomorrow. So if I didn't answer your question tonight, make sure to drop back tomorrow. If you do subscribe and turn on notifications, then you'll get notified when I go live. Any other questions right now? Okay, so we'll probably wrap it up soon. But yeah, like I said, come back tomorrow if you have a question or a follow-up question that you had. We talked a little bit about stomach aches. I was talking about IBS at the beginning, so the person that was just asking about, you know, bowel movements 4 times a day, you can go back. This will go back on my page after we end the live. You'll see it. It will show up within a couple of hours. You can go back and rewatch it. I talked about IBS and some things that can help with diarrhea as well. So,
Would you recommend consumption of sleep gummies with no addictive side effects if we are unable to sleep due to melatonin issues? If so, which one would it be?
sleep gummies. So I'm assuming you're meaning like products that are in the gummy form that are helpful for sleep. So that can be helpful short term. So whenever we're looking at sleep, we want to make sure you're doing things only short term, only really as needed, because otherwise we don't want your body to become dependent on it, right? We want to make sure you're regulating your sleep cycle without the use of anything. Something like melatonin in a small amount, 1 to 2 milligrams, you could do something like that. In the sleep gummies, I don't know any off the top of my head in terms of brands, but generally something that will have a little bit of melatonin, some magnesium in there, some GABA usually, and then it might have a herb in there like ashwagandha. It might have something like chamomile or lavender. Usually a combination of those things can be helpful for helping with sleep. So great question. Yeah, I would say it's okay to take, again, of course, if you know you don't have any other health conditions or concerns that would stop you from taking it. All right, so we're gonna wrap up for this live stream tonight. Thank you everybody for joining. If you're new here, I'm Dr. Amanda. This is Let's Talk Health. We will be back tomorrow, so if you have more questions, make sure to join us tomorrow. Make sure to like the video and subscribe, and we will see you all tomorrow.